Mr. Hosking, many Londoners live in poor quality housing. Many families are being brought up in poor quality housing. And it's estimated that well over 300,000 live in overcrowded conditions. What effect does overcrowding have on early years development?
Overcrowding is clearly, you don't need me to tell you, a very powerful and negative effect on people's health and general quality of life. We're just about to produce a report, which is a 3-year study, looking at children between the age of 2 and 18, and understanding why children slide into lives of severe and multiple disadvantage, by which we mean some combination of homelessness, mental health problems, addiction, criminality, etc. And we've also set out what we believe are solutions to this process. And the first thing that we would put on the solution is to provide people with good housing. It's the very first step in rescuing people whose lives are spiraling downwards into conditions where they end up on the streets or in our hospitals with chronic mental health problems, etc. So I certainly strongly believe that that is something that, if we can do something to improve in London, and I believe the Mayor is very committed to that, that would be a very positive thing to take place.
Can I say the jury's out on whether or not the Mayor is committed to that? There's a 250,000 words in the draft London plan, and it only mentions overcrowding once. And he's also dropped all the targets that his predecessor had for building family-sized homes. So we're quite concerned, some of us are quite concerned, that this very important social issue is actually being dropped from the agenda in London. But I'm very grateful for your words. I very much appreciate that.
Can I just say, having been in lots of overcrowded homes, it is devastating for the families and in terms of their child's development. I've been in many homes where they can't put their baby on the floor because there's nowhere to put the baby. So that has an impact on the baby's physical development in terms of not having the opportunity to learn how to roll over, learn to crawl, all those really early skills that are really important. I've been in homes where they don't have the room to put a cot up. So that baby goes from a Moses basket into bed sharing, and that puts the baby at risk of cot death. So I think, it is absolutely devastating, and for those parents living in those situations where they don't have room to put things away, they have the stacks of clothes and bags because they just don't have room at all. It is, and to go back into that environment day after day, or just to have the energy to get up and go out, in terms of their mental health and in terms of the impact on those children. Some of the conditions that I've gone into are frankly appalling. When you sit there and parents tell you about the rats that run out while they're looking after their children, I mean, it is really quite shocking. And I think that has a real impact on the workers that work with families. And I think that's one of the things about London is you get a real churn of staff because there's only so much you can take.
Yes.
When you're going in, and that's visit after visit after visit, there's no variation. You go from one to another. And your thresholds, and I think that often is what happens with social care as well, their thresholds just get higher and higher because you've been in one home and you go into another and you think, well, it's not as bad as the one that I've been into, so maybe it's okay. So I think it just has a devastating effect on people.
It must have. It must have.